Lisa, Tony, and Dr. Ahluwalia. Good morning.
Hey guys.
Good morning, Dr.
Good morning.
Ahluwalia.
You know, we're talking about first breast cancer. Many women diagnosed with breast cancer in recent years have chosen to have both breasts removed, even if they only have the cancer in one. And we're finding that there's very little benefit to this in some cases, right?
So, as we know, there are some very prominent people who have chosen to do this.
We learned last year Angelina Jolie
Right.
had both, and that was preventative, right?
So I think this is a question.
Because of the BRCA gene.
Right. But this is a question that arises in any woman who is diagnosed with breast cancer in one breast. Should I just get rid of both breasts and that way I have no risk at all?
Out of fear, of course. Yes, I would want
Exactly.
that.
So, we keep trying to find out if this is beneficial or not. So they did this study where they looked at 100,000 women followed over 20 years. And they had, stage 1 and 2 cancer in one breast. And they were trying to see, is there any difference in the life expectancy, right? So at the end of the day, people are like, I don't want to die of this, if I'm going to get it into the other breast.
Yeah, it doesn't help me out.
Right,
Yeah.
so most women don't die of a second cancer that separately develops in the other breast. It is the spread of the cancer from one breast that will kill you. Okay, so that's something important to realize. So what they found was that there was a very small difference in the life expectancy of women who chose to have the healthy breast removed versus not.
Really just a couple of months,
Well,
right?
1 to 7 months.
1 to 7 months, but it was only 1% of women.
Yeah.
So it's not that big a difference. But
So
what
medically, it's not a big difference.
well, in life expectancy,
Right.
But this didn't look into surgical complications. This didn't look into mental anguish and fear, right? It didn't look into other things that may go into making that decision. If all you want is, sort of peace of mind that I'm not going to get this back, certainly.
Unless you have the BRCA gene.
Right.
We need to
Right.
move on to the next topic, which is HIV. A lot of little things or big things surrounding it, but we've had the death of a prominent person
Yes.
involved, a researcher last week, but also diagnosis rates are lower.
Yeah, so this is very encouraging. Over the last 10 years, we have dropped the rate of HIV diagnosis by a third. This is
Wow.
great. This is a win, right?
Yeah.
But it's in everyone but gay and bisexual men. So that's the thing we need to really focus on now and make sure that they take into account what we need to do to make it less. The other thing what was interesting is that New York, for the first time, is the only state that's now pushing Truvada, which is this pill that you can take as pre-exposure prophylaxis.
Like a preventative.
Right. So in the gay community, using condoms is probably not the coolest thing, and so a lot of men don't use it. But that helps spread the HIV. So if you take this Truvada, which is known to be 90% effective, then perhaps we can cut down this risk. Now, we're not saying don't use condoms. Please use condoms. That's the
If you
most.
use both, it would be
That's the most effective thing. But if we can do something else, then I think this is something that's.
And how
working.
long has that been in effect in New York?
They just announced it.
So
but it's been
Yeah.
approved since 2012 for this purpose.
So we won't know for a number of years how effective
Correct.
it
But
is.
I mean, we know it's 90% effective to exposure. So great news. Very sad about the
doctor.
researchers who died on the plane.
Yeah.
But I think overall it's looking good.
Dr. A, always good to see you.
Thank you
for
so much.
coming in
Pleasure.
and enlightening us.
Thank you very much.